Good morning, everyone. Thank you all for being here. Again, my name is Marlene Pinotti, and I'm the Adult Unit Supervisor here in the Santa Clarita office.
Hi, my name is Jennifer Lee. I'm the adult supervisor for the San Fernando office. Thanks for being here.
And unfortunately, we did have another member, our colleague Fernanda Zabalza, who assisted with this presentation. She was unable to be here today. Here's our agenda for the day. So we are going to cover regional center services for consumers, including personal assistance, respite, independent living services, and coordinated family services. We will also cover generic resources, including IHSS and the nursing waiver, Medi-Cal and Medicare, CalFresh meal and senior programs, Section 8 HUD and senior housing utility programs, transportation, elder abuse and APS, and also afterlife planning, including legal and financial services, payee services, and other living options. We will also review a few examples of some real life scenarios, and we will have time for question and answer. So first, let's review regional center services for consumers and families. So one of our personal assistance services is for adult consumers who choose to live in the family home and may require care and supervision that parents, guardians, or caregivers may not be able to provide due to aging, declining health, or other mitigating factors. As such, NLA-CRC will provide personal assistance services to adult consumers who are in need of care and supervision. Personal care assistance services can include support with the tasks of daily living, such as bathing, toileting, dressing, grooming, making meals, feeding, protective supervision, going to appointments, and community
Y
activities.
a las citas y actividades de la comunidad. También nosotros ofrecemos lo que es servicios de respite para familias.
Services give families time away from the demands of caring for a person with a developmental disability. So it's designed to give them a break, maybe go out to lunch with friends or out to a movie, have a date night with their husband. Respite can be planned or on an emergency basis and take place either in the family's home, otherwise known as in-home respite, or we can also offer out-of-home respite, which is at a licensed residential facility. In-home versus out-of-home respite. So in-home respite, there are two main types of in-home respite services. So one is family conversion respite. If your family has someone over the age of 18 in mind to be a respite worker, you can refer that person to be hired by a respite agency. If the person you refer is eligible to work and is hired, then you can schedule directly with them. The other option is agency respite. If your family does not have someone in mind, you can hire a respite worker through an agency. You would work with the agency to choose the staff and schedule staff to come to your home. In-home respite can be provided at a nursing level or behavioral level. An assessment can help you know what level of care is needed so you can choose an agency qualified to provide that level of care. And then out-of-home respite allows consumers to stay in a licensed home for up to 21 days. Independent living skills can also be provided to adults living in the family home. Otherwise known as ILS, it teaches adults money management, meal planning, accessing community resources, and safety skills. ILS may also help make sure that grocery shopping is done, medical appointments are made, and that basic living needs and bills are paid. And we have a newer service that we just started pretty recently called Coordinated Family Services, otherwise known as CFS. This is a
también
new
conocido como
service that
CFS.
is
Este es un
specifically
servicio nuevo.
designed
Es
for
específico
adults
diseñado
with
para
developmental
adultos con
disabilities
desarrollos
who
y
choose to live with
capacidades
their
quienes
families.
seleccionan vivir con sus familias.
Services are tailored,
Servicios,
individualized, and
estos
flexible
están
to
de
meet
una
the
forma
changing
individual y
needs and
flexible para
preferences
poder
of the
reunir los
individual
cambios y
being
las
served
preferencias
along
de las
with their
necesidades.
family and
Estos
caregiver.
individuos se les puede servir con sus
The
familias
coordinated
junto con las
family
personas que los
services are
cuidan.
designed to
Los
help you
servicios
and your
familiares de
family coordinate
son
and schedule the
diseñados para ayudar a su
services you
familia a
receive.
coordinar los servicios de
CFS
programación
can
que
assist with
reciben.
planning for the
CSF
future
puede
as
asistir,
well as
planear en
help
el
you learn
futuro,
how to
también
access
ayudarle a usted
additional
cómo
services
acceder
that
a
you may be
servicios
eligible
adicionales que
for.
usted puede calificar para ellos.
CFS can coordinate training
CSF
for the people
puede
who
coordinar
support you
entrenamiento o
so that they
capacitación
are
para
better
personas que le
prepared to
apoyen
work
para
with
que estén más
you and your
preparados para
family.
trabajar con usted y su
Services will
familia.
be provided
Servicios
in
van a
your
ser
language and in a
proporcionados en
way
su
that is
idioma y en
respectful
una
of your
forma
culture.
con respeto en su cultura.
Payee services. So this is another service
Servicios
that Regional
pagados. Esto es otro
Center can
servicio
fund
que el
our
centro regional puede
consumers
planear para
when a
nuestros
consumer
consumidores.
works
Cuando
or
un consumidor
receives
trabaja, va a
benefits
recibir
such as
servicios
SSI.
públicos.
They can authorize a designated person or agency to oversee their income. This person or agency becomes the representative payee and helps ensure the consumer's bills are paid. They also work to make sure the consumer does not become over-resourced and lose eligibility for public benefits. Regional centers are contracted with vendors to provide payee services at no cost to the consumer. The vendor is called a money management service provider, or it can be a parent, family member, or friend. Living options. So we'll review some of our options for consumers that may want to move outside of the family home or are no longer able to be cared for in the family home. So community care facilities are one of our living options. They're also called CCF homes. And these are homes in the community that are licensed by community care licensing. So we do have different levels of care in our CCF homes. For level 2, these provide care, supervision, and incidental training for persons with some self-care skills and no major behavior problems. Level 3 homes provide care, supervision, and ongoing training for persons with significant deficits in self-help skills and or some limitations in physical coordination and mobility, and or disruptive or self-injurious behavior. And level 4 provides care, supervision, and professionally supervised training for persons with deficits in self-help skills and or severe impairment in physical coordination and mobility, and or severely disruptive or self-injurious behavior. Service level 4 is subdivided into levels 4A through 4I, in which staffing levels are increased to correspond to the escalating severity of disability levels. We also have additional higher level facilities that can also be considered if necessary, and these include enhanced behavioral support homes, or EBSH, and skilled residential facilities, or SRF. And here's some additional information on the different CCF levels of care. So for service level 2, it's a home-like family setting. They provide general supervision with ongoing training. The staffing ratio of consumers to staff is 1:6. Quality assurance visits are conducted by NLA CRC to ensure compliance with Title 17 and 22. They can be owner-operated or staff-operated. And normally the individuals that are appropriate for these homes have no major behavior problems. For service level 3, they also provide general care and supervision, ongoing training for consumers with significant deficits, and the staffing ratio is 1:3 and may include additional weekly hours. They are also monitored by our quality assurance to ensure compliance with Title 17 and 22. And lastly, service level 4 provides general care supervision and systematic training for consumers with severe deficits. They also provide consultant services and behavioral programming. And again, they are subdivided into levels 4A through 4I based on staffing ratios. And again, quality assurance visits are conducted by NLA CRC to ensure compliance with Title 17 and 22. An alternative living option that we also can fund for is called a Family Home Agency, or FHA. And this offers the opportunity for up to 2 adult individuals with developmental disabilities per home to reside with the family and share in the interaction and responsibilities of being part of a family. It enables the individual to be a participating member of the family and the community where the family resides. FHAs are private organizations vendored by a regional center. They are responsible for recruiting, training, approving, and monitoring family homes, as well as providing ongoing support to family homes. The FHA staff make regular visits to the family home to ensure that necessary services and supports are in place and that the match between the family and the new family member continues to be appropriate. In addition, there are also intermediate care facilities, and there are different levels of care facilities. There's DD, DDH, and DDN homes. These are health facilities that are licensed and monitored by the California Department of Public Health to provide 24-hour per day residential services. So these ICF homes are funded by Medicaid or Medi-Cal and must follow the Title 22 or state regulations. They may have 15 beds or less and offer active treatment, and they are managed by a qualified intellectual disabilities professional or QIDP. So again, there are 3 types of ICFs, which all provide services to individuals with developmental disabilities. They are ICF-DD, ICF-DDH, and ICF-DDN. An ICF-DD, or developmentally disabled, provides 24-hour personal care, habilitation, developmental, and supportive health services to residents whose primary need is for developmental services and who have a recurring but intermittent need for skilled nursing services. The ICF-DDH, or habilitative facilities, have a capacity of 4 to 15 beds and provide 24-hour personal care, habilitation, developmental, and supportive health services to residents with intermittent recurring needs for nursing services who have also been certified by a physician and surgeon as not requiring availability of continuous skilled nursing care. And lastly, the ICF-DDN, or nursing facilities, have a capacity of 4 to 15 beds and provide 24-hour personal care, developmental services, and nursing supervision to residents with intermittent recurring needs for skilled nursing care who have been certified by a physician and surgeon as not requiring continuous skilled nursing care. These facilities serve medically fragile persons who have developmental disabilities or demonstrate significant developmental delay that may lead to a developmental disability if not treated. And residential care facilities for the elderly are an additional living option. They're also known as RCFE homes. These are residential settings that provide housing, meals, and assistance with daily living activities for older adults who need some help but don't require the level of care provided by a nursing home. Our CFEs provide safe and healthy living accommodations, acting as a supportive option for those who need assistance but don't require full nursing care. These homes cater to seniors ages 60 and older. They offer care, assistance with activities of daily living, meals, and general supervision. They offer a care plan that considers both physical needs and individual preferences, provide a congenial place for socializing in a friendly, peaceful environment, aim for an atmosphere that is warm, inviting, and home-like, promote maximum independence and dignity, encourage the family and community involvement to enhance residents' quality of life. Services include housekeeping, personal care, dressing, bathing, and medication management. Our CFEs act as a bridge between independent living and 24-hour nursing care. Unlike medical facilities, they don't necessarily have nurses or doctors on staff. Ancillary services may include consistent monitoring, healthy meals, recreational activities, and outings. And I'll pass it over to Jennifer.
Okay, and next we have, thank you so much, Marlene, for that. So she covered the services regional center funds. So my part of the presentation is on generic resources. These are resources that can be used for our consumers, regional center consumers, or perhaps their aging elderly parents, or anyone actually really that would qualify for these type of benefit. So let's start with IHSS and nursing waiver. In-home support services, IHSS, is the eligibility is that the person needs to physically reside in the United States and be a California resident, must have Medi-Cal eligibility because it's funded by Medi-Cal, must live at home, and must submit a completed healthcare certification form. This requires doctor's certification. The type of services IHSS provides are household tasks, cleaning, meal preparation, laundry, grocery shopping, personal care services, including bowel bladder care, bathing, grooming, and paramedical services. They also accompany clients to medical appointments, and they can drive the clients to and from medical appointments, and also provide what's called a protective supervision hours. This oftentimes is approximately 280 3 or 5 hours per month, and this also requires a physician certification. The application process is quite simple. You'll be surprised. You can call this hotline to file a phone application, and it can be done by anyone. They do require some private information to verify the identities of the client. So if you have that information, anyone can really call this number to apply on behalf of the person. Or you can visit the website. The next part of this slide is on nursing facility waiver, and this is funded through the Department of Health for individuals with restricted medical condition. So commonly referred to as nursing. If they require LVN level of care, for example, they can apply for this program and get some nursing and RN eval hours. And if the hours are not sufficient, sometimes regional center will supplement the remainder of the needs. Next slides, please. Next is on Medi-Cal and Medicare. We get a lot of questions on this. Medicare is of course, federally funded health insurance program for 65 years of age or older, or certain younger individuals with qualifying disability for this program. There are Part A, B, and D under Medicare, and Part A is on hospital insurance. This covers hospital stays, skilled nursing care, hospice care, and limited home health care services. You typically pay a deductible and coinsurance, and or co-payments. So there's some cost involved with this. Inpatient care at a hospital, skilled nursing facility care, nursing home care. So this kind of talks about inpatient care in a skilled nursing that's not custodial or long-term. Basically, clients who are staying at nursing home for months and months. It's not covered by this. So that's what it's saying. Hospice care, home health care, which is already mentioned up there. Part B of Medicare funds for typical medical insurance. This is doctor's visit, medically necessary services, preventative service, such as clinical research, ambulance service, durable medical equipment, mental health services, and limited outpatient prescription drugs. They do have a Part D, which covers prescription drug coverage. This covers the cost of prescription drugs, including recommended shots or vaccines. Next is Medi-Cal. It's a public program that provides healthcare coverage to adults, families, older adults, and people with disability who meets the income requirements. So undocumented, this is the latest addition to the Medi-Cal program. Undocumented individuals now qualify if they're over the age of 50. And this, I believe, was added a few years back. So there's a way for them to qualify for Medi-Cal. Next slide. Next is CalFresh meal programs and programs for seniors. So at the end of this slide, we will have a presenter from One Generation share their part of the presentation. So CalFresh is the largest food program in California and provides essential hunger safety net. This is a federally mandated program in California and is state supervised and county operated. So in the county of LA, this is monitored by the DPSS. This is the link where you can apply. Application process is quite simple as well. Next one is Meals on Wheels. These are the program that provides hot and nutrition lunches that's delivered Monday through Friday to the homebound elderly. The requirements are the person should be 60 plus years old or a spouse of someone who's 60 years or older, or at risk of being at malnutrition, unable to come into the Meals on Wheels center for a meal. And here are the local 3 centers in San Fernando Valley where you can get sign up for the program and participate or refer somebody who might be eligible. Next is adult day healthcare programs. This is a day activity programs for senior citizens and some of our consumers who qualify. Sorry for the typo, Anastasia. Anastasia Plugia with One Generation will be presenting their part of the presentation here, and they will share more information about their program and their participation for the Meals on Wheels program. Anastasia, are you here to join us?
I'm here to join you.
Thank you so much,
Jennifer. Hi, my name is Anastasia. I'm the program director over at One Generation Adult Daycare. Our adult daycare is a unique nonprofit, duly licensed adult daycare, adult day healthcare, located here in San Fernando Valley in Manais. Our licensed hours are Monday through Friday from 9:30 a.m. to 3:30 p.m. We do offer extended hours to those families that are working at an additional cost. What we do here is our participants arrive in the morning. We have light breakfast. We have an exercise program with our physical and occupational therapists. We have cognitively stimulating activities going on, scheduled all day. We have big activities such as bingo, sing-along, pretty much every day. Our daily attendance is about 35 to 39 people per day. Staff to client ratio is 1 to 5. So we have a very big staff team to help our participants. Our client population primarily speaks English and Spanish, and the age ranges from our youngest participant right now is 42 and our oldest is 103. And most of our participants here do have some memory loss, some cognitive decline due to Alzheimer's and dementia. And we do also have several participants here who are older adults that have intellectual and developmental disabilities, and we're able to blend those two populations. So we have two different models here. We have the health track model and we have the social model. The referrals from Medi-Cal Regional Center and Veterans Administration, they're all part of the health model where they receive these extra services from occupational therapy, physical therapy, nutritionist, speech therapist, activity coordinator, social worker. So they receive all these, are eligible to receive all these services from these disciplines. We work very close with the participants too. The whole team reassesses every participant every 3 months, and we meet with the family for a multidisciplinary team meeting and care planning every 6 months. And the social track model has access to LVN, activities, and social work, and the social model is the private pay model that we have. What makes us most unique here at One Generation is our intergenerational program. We are a shared site with our childcare, and we have scheduled up to 7 activities per day where we integrate the children and the older adults together. And we do all types of activities from arts and crafts, cooking, gardening, music, sports, a lot of different activities where older adults participate together with children. And we also take some of our older adults on the nature work to childcare, to cuddle the babies, feed the babies. Our childcare actually accepts children from 6 weeks to 5 years old. So we have that age range. And it's all, of course, person-centered, optional, depending on if a participant wants to participate in the intergenerational program. And they always have a choice to participate in the intergenerational program or participate in our main activities. That's it for my presentation on our adult daycare.
Okay, thank you so much. I know you had beautiful slides, but unfortunately we weren't able to upload. But do you sometimes have a parent and the child attending ADHC together? Is that something you guys have seen?
We, for our individuals with developmental and intellectual disabilities, we do have their aides coming with them at times. We don't have a situation with a parent right now, but that I'm sure that could be arranged.
Yeah, because I was asking because we sometimes we have our clients, sometimes if their parent is also their age qualifies for ADHC, I've had a situation where they both attend the ADHC together, and that
sounds like
right.
That sounds absolutely possible. Yes.
Yeah. So One Generation ADHC portion of the program is good for our maybe a great match for our clients, also for their elderly parents, if their insurance funds, especially. How about your Meals on Wheels program?
That would be Lori's part of the presentation. Okay. Meals on Wheels.
Oh, Lori, thanks. You have your hands up. Would you like to share on your Meals on Wheels program?
Sure. I don't oversee the Meals on Wheels program, but we do have a Meals on Wheels program that covers parts of the San Fernando Valley. It's a large program. The person you would contact for that, and I can put her name and number in the chat, is Dolores. And Dolores, let me take a look here. Dolores is Anastasia. What is Dolores's last name? I'm looking.
Dolores Freeman.
Dolores Freeman. So she can connect with Meals on Wheels, and they serve they deliver 5 days a week, and they also have frozen meals.
Okay.
And then it's a sliding scale. And then I also wanted to add that we also have for what we have One Caregiver Resource Center, and I can put the link to that in the chat. And that was the slides that I sent over, which is okay that you haven't loaded them. It's fine. I can just verbally tell you that we have over 200 resources on the website for caregivers, for adult children. Oh, there we are. It's right up there. Okay. So should I just click ahead, or you guys will click ahead? Sorry about that. I thought we didn't load them. So anyway, we have one Caregiver Resource Center. It's a centralized platform that we created through a grant from the Administration for Community Living. And it started off as a little sheet, and it blossomed into several pages with over 200 resources. It's for caregivers, professionals, your staff at NLACRC. We work closely with your staff. Can also go on and leverage resources. If you go to the next slide, I'll go over the pages real quick. I know we don't have a lot of time. It's a centralized platform for adults to support caregivers, adults with intellectual and developmental disabilities who may be at risk of or living with Alzheimer's disease and related dementia. So if we go to the next slide. Okay, so we have a page specifically for healthy living for adults with IDD and ADRD, and that has all kinds of tools, what to do when you go to a doctor, how to interview a doctor. We have a separate page for what is dementia in general. Then we have a page for dementia in adults with intellectual and developmental disabilities, and that has a lot of information. We have effective communication about dementia. How do you communicate with your adult child about dementia? How do you communicate with them about their memory loss? Because we know that people with Down syndrome have a higher probability of getting early onset dementia. Not all of them, but a lot of them. So how do you communicate that with your children? How do you communicate with your adult children about maybe you having dementia, and work with that? We have a page on advanced planning and end-of-life decisions. And all of these also have recordings, and it's all made to be user-friendly for this population. What is really, we have research and self-care and respite for caregivers, so that's support groups that can be accessed. I know right now the Alzheimer's Association in Los Angeles has a specific support group for parents who are taking care of adult children that are showing signs of Alzheimer's disease and related dementia. And my number's in the last slide, which you can call me. And then what's really, really great is we have a page for archived educational trainings. And that has all the trainings that we did with the NTG, which is the National Task Group. And they're all archived there. So if you don't have time to go to a webinar, there's webinars that are blasted out all the time. We have a lot of them that are on that page that you can just listen to when you have the time, pause it when you need to. So we're trying to make it easy and accommodating for all of our caregivers. So that's what I got with Anastasia.
Thank you so much. This is great information. Thank you so much, Lori and Anastasia. Okay, so we also put, going back to our slides, we have One Generation's address, phone number, and I believe the website is there. Sorry, Marlene, you have to maneuver back and forth. So this is a great resource for both, again, clients and their elderly parents. Yeah, here's that address. Okay, so the next slides is on Section 8 HUD and senior housing. This is, there's much interest on this for the adult population and their senior parents. So the Housing Choice Voucher Program, also known as Section 8, is a federally funded rent subsidy program for low-income families, disabled, and the elderly. This is administered by the Department of Housing and Urban Development, known as HUD. Section 8 program for LA County is currently not accepting new application though, and their waitlist is also closed, and their waitlist is infamously quite long, but they do occasionally open windows for application. So you'll hear here and there, the waitlist is open, so there is a slight possibility here and there to add the client's name under the waitlist. Now for LA County, here is the Housing Authority of City of LA's contact information where you can get more information about the program. And on this website, they list all the apartments that accept Section 8 also. And there's other types of housing programs that you can find out about more, other besides the Section 8. And here's another resource, LA County Development Authority, LACDS, their phone number and website where you can get more information. I've also included the Ventura County and Glendale Housing Authority number and their website because their wait list is much shorter, a fraction of LA County. So this might be worth looking at if somebody is interested in, say, moving to Simi Valley, quite close to San Fernando, but they would fall under Ventura County. So this is where you get that information. Same with the Glendale. Okay, next slide. Next is on utilities, DWP, LAHEAP, and Lifeline information. So the Department of Water and Power, they have a discount program for low-income families. And here's the number where you can call for more information. There's several different programs. There is that life support equipment program. This is a discount to households who uses an eligible life support devices such as motorized wheelchairs that needs to be charged, respirators, dialysis machines, and other life supporting equipments. I've also had a family member who had AC, who requires an AC that needs to be at certain temperature setting, and they also qualified as well. California Department of Community Services and Development, their number is here. This is a program that can be, that also offers a discounted rate for utility programs. So LIHEAP is a low-income home energy assistance program. It's a federal program that helps low-income families with home energy bills, energy crisis, and weatherization and minor repairs. Lifeline rate program is for seniors and disabled citizens. Program offers exemption on their electric and their utility bills. LIHWAP, sorry for all this acronym. It's a low-income household water assistance program. This is also for low-income families, the discounted program for the water bill. Free smartphones through Lifeline administered by Federal Communications Commission's FCC. This is some people refer to it as the Obama phone. You can apply online here and obtain a free smartphone or landline. It's a great resource for low-income families. The eligibility is here. You must be receiving Medi-Cal, SSI, Section 8, WIC, CalWORKS, GAIN, or CalFresh, or low-income families. So as an example, for a family of 4, this is the published information online currently, $48,400 annually income-wise, you would qualify for this program. Next slide. Now for transportation, there's some options for families and their clients and families. Access Parent Transit, which is a popular program. Here's a number to apply for application and another number to make a reservation for transportation service. Access is a form of public transportation. They offer a share ride service for persons with disabilities who, because of their disability, are unable to use regular bus and rail services. One-way trip fare is an example, is a $2.75 per ride, and it covers up to 19.9 miles. So anything above 20 miles or more ride, it will be $3.50 per ride. And there's a different cost information. All this information is online on their website. And Metro LA is the LA Metro, the bus, but known as the public transportation bus. For seniors 62 or older or individual with disability, they have a discount. They're eligible for discounted rate up to 80% off the regular Metro fares. But if you happen to have access eligibility to ride the LA Metro bus is free of service. So next is a non-medical transportation. This is a transportation to and from medical appointments, and this is covered by full scope Medi-Cal and Medicare Part B plan. Okay, next slide. Next slide is on APS and elder abuse. This is not a resource, like in the sense of a program you can apply for, but this is an important resource to information to be mindful, because as our population gets older or their parents are aging, we need to recognize what type of abuse are occurring, may be occurring, and some other warning signs, and how to report this. And by reporting to APS, and here's the number or the website link here, you can set different motions in place for that triggers investigation and maybe possible services to kick in. So elder abuse refers to any several forms of maltreatment of an older person by a caregiver, family, spouse, or friend. So we oftentimes think about physical abuse, but there are a variety of abuse, and which I'll cover right here. Types of abuse are, of course, physical abuse. These are obvious type of abuse: hitting, kicking, burning, dragging over and under, medicating. Sexual abuse, unwanted sexual contact, sexual exploitation, abandonment, desertion, or willful forsaking by another, anyone having responsibility for care, so by the caregiver. Isolation, preventing the individual from receiving mail, telephone calls, and visitors. Sometimes people don't connect this with abuse, but I think this is very important. That's why it's underlined. It is a form of abuse. Financial abuse, theft, misuse of funds or property, extortion, fraud, neglect, failure to provide food, clothing, shelter, or healthcare. Mental abuse, verbal assault, threats, or causing fear. Warning signs, our clients sometimes it's difficult to tell. Maybe they're limited in their communication, or maybe their parents are limited in their communication. These are some of the warning signs to look out for. Unexplained injuries or inconsistent explanation. Altered state of mind, seems confused or disoriented. Caregivers' behavior is whether they're angry, indifferent, or aggressive towards the elder or dependent adult. Missing personal belongings. The elder appears hesitant to talk openly. Something is stopping them from opening up. Lack of necessities such as food, water, utilities, medication, and medical care. Another person's name added to the client's bank account or important documents, or frequent checks made out to cash. Next slide. Okay, so next slide is on LEAP EMDT. This is a local elder abuse prevention enhanced multidisciplinary team. Here's a number. This is a valuable resource that covers anyone who's over 60 or older who's at risk for being abused. This program is a professional experts review elderly abuse cases. They link older adults to network of services, provide case management services, while connecting to services, continually checking in to offer comprehensive benefits and assess for ongoing support. I believe there are several local providers who are under this umbrella of service. Northridge Hospital, Dignity Health has a team over there that meets quite regularly. And I had a case one time where the parent, we didn't have any service, obviously, for the parent, but they were able to connect them with this service and meet monthly and provide valuable case management service. So any older adult, 60 or older, resident of LA County and suspected of abuse, neglect, or financial exploitation can be referred to LEAP EMDT for services. Their disciplinary team is a team that brings together professionals from different fields like Dignity Health, Northridge Hospital Medical Center, Valley Care Community Consortium, Alzheimer's Association of Southland Chapter, One Generation. Southern California Neuropsychology Group, forensic accountant, and VetSedec to develop best practices, ensure the victim's safety, and train the public to identify and intervene before a senior is abused. So it's a valuable resource to become familiar with. Next slide. So the next slides are on afterlife planning. So let's move on to the next slide. We're going to cover some of the common topic, including Advance Directive and will. So Advance Directive is a California Advanced Healthcare Directive allows an individuals to choose an agent to make medical decisions on their behalf and select end-of-life treatment options. An Advance Directive combines the medical power of attorney and a living will. VetSedec usually helps complete a form. They're a nonprofit legal entity that can be, they can lend a hand when completing a form, which can be quite daunting, and a form of Advance Directive but also gives an option in completing the form on your own. For it to be validated while completing on your own, you need to have two adult witness or notary when signing. So you basically have to notarize the Advance Directive to make it official. Institute for Healthcare Advance Directive is an easy-to-read California Advanced Healthcare Directive form, and it can be found at this website here. And this is another resource down here, agingwithdignity.org. So next one is on will. It's living will are a legal document that expresses a person's wishes as to how their property is to be distributed after their death and to which person to manage the property until its final distribution. Regional Center don't get directly involved in this type of, but I think this topic do come up quite often, and a lot of families are interested, especially if the parents are aging. So this is something to be mindful. Next slide. So the next slide is also continuing on afterlife planning. So trust is something that also comes up quite often, is an arrangement whereby a person holds property as its nominal owner for the good of one or more beneficiary. You can set up a trust with your bank. You'll need to provide them with the names and contact information of the trustees. Affidavit is a written statement confirmed by an oath or affirmation, can be used as a sworn statement before a person makes a notary and be used as an evidence in court. Funeral planning, look at local funeral homes and cemetery that best fits your financial situation. There's also what's called a Thinking Ahead booklet, which I believe there's no link here, but this can be located online. You can Google search by the Department of Developmental Services. This provides a step-by-step guide on your planning for your future to help you prepare for the Advance Directive. Public administrator. If no prior arrangement for afterlife have been made, the public administrator will be responsible for afterlife arrangements. Next slide. Legal and financial services. VetSedec is a self-help conservatorship clinic that provides free assistance to anyone who wants to file for conservatorship without representation needed by an attorney. Here's a number and email and web link to get more information and sign up for some of they have a lot of valuable information and seminar options too on their website. So here's a review of HUD with the link in section 8. Now CalAble is something we have not covered. This is an investment and savings account available to eligible individuals with disabilities. Once this account is set up, it can be spent on education, transportation, health preventions, and wellness-assisted technology and personal support, housing, and employment. To be eligible for CalAble account, the disability must have occurred before age 26 if you meet the age and receive benefits under SSI and SSDI. For more information on how CalAble works, here's the link to learn more about. You can also call a number or email for more information. And Marlene, oh, okay. Example 1, would you cover number 1, please?
Yes, hello. So we are going to just review a few real life scenarios and how those individuals or families' needs were met. So we have our first case here, a consumer named Patty. Of course, the names have been changed. Patty is a 50-year-old woman who lives alone with her 88-year-old mother. Her father passed away many years ago. Patty is nonverbal and non-ambulatory, and she is dependent on others for all activities of daily living. Patty's mother has been caring for Patty her entire life. However, she is no longer able to do so due to her age. Although Patty has 2 sisters that live locally and assist when they can, they are all very busy with their own jobs and families and are not available to provide all the care and support that Patty requires. Patty does not currently have Medi-Cal or IHSS, as her benefits lapsed some time ago, and her mother needs assistance with reapplying on her behalf. So for Patty and her family, our plan for support was to refer Patty and her family for coordinated family supports for assistance with reapplying for Medi-Cal benefits and accessing other available generic resources. In addition, CFS will be providing direct care to Patty on a temporary basis until she is able to obtain IHSS, and will be supporting Patty and her family with developing a plan to ensure her well-being for the future.
Okay, so I will share the example number 2. This is based on true story, by the way. And Maria, not her true name, but Maria is a 55-year-old woman with mild ID and epilepsy. She is co-conserved by her mother and brother. However, her brother has passed away. Her mother is 89 years old and is suspected she may have dementia. Maria walks with a walker and has occasional seizures. Maria is not eligible for IHSS or Medi-Cal due to assets. Since her brother's sudden death during the pandemic, Maria has been caring for her mother, and the family struggles with maintaining caregivers for Maria as the mother interferes with her services in addition to neglecting her own care. The mother here refuses to release Maria's SSA funds for food and other necessities. In recent years, APS and law enforcement were called to the home due to domestic altercation between Maria and her mother. There have been also multiple allegations of fiduciary abuse made by Maria's former providers and local church members. Previous efforts by IPP team to implement services are planned, sorry, my slides are not reading, as planned have been unsuccessful, sorry. Okay, so this is based on true scenario, and it's a really challenging case. So here were our, what we ended up coming up with as a plan for support. And there was happy ending. So file APS for fiduciary allegations and abuse for elderly and disabled. Report concerns with existing conservatorship to probate court. This was to remove mom as a conservator. Start with the probate investigator. Explore coordinated family support. Explore LEAP and EMDT for services and support for Maria's mom, who's suspected of abuse and dementia. Explore representative payee service, so Maria can access her SSDI funds. Refer Maria and mom for generic resources for food assistance and lower utility bills. Okay, so this was our effort to make some sense of variety of information we shared today. So I hope it was helpful.